Recently, Oprah Winfrey shared something unexpected. After she started taking a GLP-1 medication for weight loss, she noticed that she completely lost her desire to drink alcohol. And she is not alone. A growing body of research suggests that these medications not only reduce the desire to eat, but they also reduce cravings for alcohol and other substances. Hello and welcome to the Dr. Suzette Glasner Podcast. With an estimated 1 in 8 Americans now taking a GLP-1 medication like Ozempic or Wegovy, and declining costs making these medicines more accessible than ever before, they may represent something much bigger than weight loss. And that is a potential shift in the way that we treat addiction. Now sober for several years, because Oprah started taking the GLP-1 medicine in 2023, Oprah has described herself as someone who loved tequila and someone who could drink anyone under the table, even taking up to 17 shots in a single night, which makes what happened next even more striking, which is after starting a GLP-1 medication, stopping drinking wasn't part of her plan. She simply lost the desire. And as researchers are beginning to understand, this may reflect how these medications affect the brain's reward and cravings pathways. So, what is actually happening here? Let's start with how the GLP-1 medications work, for those of you who don't know. GLP-1 is a hormone that is released after we eat that helps regulate the feeling of fullness. So it signals fullness to the brain and helps regulate our appetite. So what GLP-1 medications like Ozempic and Wegovy do is they mimic that signal, essentially telling the brain, you don't need any more. And that's how they produce significant weight loss. But what's especially important is that these medicines are acting on the brain and influencing dopamine, which many of you know is our brain's pleasure chemical, our reward signal that drives anticipation of things that we want and even craving for things that we want. When you reduce your dopamine response in the brain, that urge lessens or weakens. So when somebody who loves a certain food, like an ice cream sundae, is taking a GLP-1 medication and they see that in front of them, they don't feel that same kind of pull toward it. And that same reward system is involved in cravings for alcohol, nicotine, and other substances. If these medications are dampening the brain's response to food cues, the question becomes, could they also reduce the desire for alcohol and drugs? And that's exactly what researchers are now studying. So let me summarize what we know so far from research. The research is still early, but the signal is very consistent. In early clinical trials, people taking medications like Ozempic show significantly fewer cravings for alcohol, lower rates of alcohol use, and fewer days of heavy drinking compared to people who took a placebo, or you could think of it as a sugar pill that doesn't act in any way on the brain to change one's appetite for food or substances. One of the most compelling pieces of evidence comes from large real-world studies using medical records. So in one study of over 80,000 people, taking semaglutide had about a 50% lower risk of developing an alcohol use disorder, or what we call alcohol addiction in its severe form. And similarly, among people who already had an alcohol use disorder, a lower risk of relapse if they already had a drinking problem. When researchers looked at an even larger group of 600,000 people, or close to 600,000 people, they saw the same pattern. So separate studies looking at other substances apart from alcohol have shown very similar signals. People taking these medications are also showing lower rates of addiction to cannabis, fewer complications of smoking, and even a lower risk of opioid overdose. That's what we know so far from studies. It's very interesting that there are different studies conducted by different researchers coming from different laboratories and different methods, from animal models to health records to clinical trials, and they are all pointing at the same signal, which is that these medications effectively reduce substance use, reduce cravings, and even can reduce the onset or development of a substance use disorder in some people who don't have one compared to people who are taking a different type of medication. What we don't know is how well these medications work for particular subgroups of people. So who do these medicines work best for with addictions? A lot of the studies that we've seen so far have been in people who are being treated already for obesity or for diabetes. So we know it works pretty well in those individuals, but whether it could be a standalone treatment for people with addiction who don't have those problems is something we need to study a little bit more. So we still don't fully understand how best to use them, because it's showing this very consistent effect across different types of studies and different types of populations. It's definitely worth considering and talking with your doctor about. Let's talk about why this matters and why this is so significant. First, these medications act on core reward pathways in the brain, and that means that they have the potential to help us with multiple types of addiction, not just one. And right now, we don't have widely available treatments for people who have overlapping addictions to more than one substance. But there's another reason that this matters. It's a little bit more of a cultural reason, in that it changes the way and has the potential to promote a cultural shift in the way that we think about addiction. For a long time, addiction and even struggles with food have been thought of as an issue of willpower, or a matter of willpower, something that we could be or should be able to control. And Oprah Winfrey has spoken pretty openly about this. For years, she described feeling that her struggles were something that she should be able to manage on her own. But her experience with GLP-1 medications really shifted that perspective. And she realized that biology, not just willpower, was playing a major role in the struggles that she'd been facing throughout her life to maintain a weight that she felt was healthy and that she felt happy with. And that shift, in her words, was really freeing, because what we're seeing with these medications is really different. People aren't just trying harder to stop, or to stop overeating, or to stop drinking alcohol or using other substances. They're experiencing less desire to begin with. And that really changes the conversation from this is about making better choices about how we eat or how much we drink, to this is about how the brain is functioning. And when we understand addiction through that lens, it reduces stigma, and it really makes it easier for people to raise their hand and say, I have a problem and I need help, which is something that we're really lacking right now. Among people with a diagnosable substance use disorder or problematic alcohol or other substance use, less than 10% of them receive treatment today. And there are various reasons for this, but one of them is because of stigma. They're afraid to say that they need help. They're afraid of how that's going to impact their job, the way people perceive them. They're worried about being judged. They're worried about being labeled. So if we start to think about this like obesity as a chronic illness for which a medication treatment is indicated and can help a person to make the kind of behavioral adjustments that are needed in order to be well, that really changes the way that we're thinking about the illness. And finally, let's talk a little bit about who might benefit from this and what should we be cautious about. First, it's important to note that these medications, while being very rigorously studied and while very promising in terms of the evidence we have so far for their effectiveness with addictions, are not FDA approved for treating addiction. So that doesn't mean that they can't be prescribed for addiction, but when they're used this way, that's considered off-label. Off-label use of medications simply means that a doctor is prescribing them for something that they're not specifically FDA approved for as a treatment indication for that medicine, but that in their clinical judgment, this could be really helpful to a patient with a certain kind of problem. And this is very common practice in medicine. It's up to the physician or prescriber's clinical judgment and their knowledge of the research on how well that medication works and what the risks and benefits are to treat something else that falls outside of what it was initially approved for. So while it's not uncommon, it does require careful consideration. So I would suggest that if you are struggling with addiction, nothing has worked for you, or you're curious about how this could work for you, talk with your doctor about the potential risks and benefits of trying a GLP-1 medication and see whether it could be a worthwhile option for you based on what we know so far. The other thing to keep in mind is that this is best understood as a tool and not as a cure. So these medications may reduce the intensity of cravings, but they don't replace the need for therapy, support, and really addressing the underlying drivers or the triggers of alcohol or other substance use. And not everyone will respond the same way, so there's no guarantee that this is going to work for you. It's another tool in the toolbox and something to consider and talk with your provider about. So where does this leave us? We are still early, but what we are seeing is quite promising. And for many people, the hardest part of changing behavior isn't knowing what to do. It's managing the pull to keep doing what they're trying to stop doing. And if that pull could be reduced even a little, that can open the door to meaningful change. So I hope you've learned something valuable, and I look forward to seeing you next time.